Balik mga kapuso sa GMA Regional TV Live, hisbutanan gyud kay karon sa atong katilingban kining vaccine batok sa COVID-19. Sa Amerika mga kapuso, nasugdan na ang pagpabakuna niini, labi na nini mga health professionals or mga frontliners. Karong buntaga makauban nato kining usa ka Pinay nga midetalye gyud ug mi-document sa iyang kasinatian niining iyang pagpabakuna batok sa COVID-19. Makauban nato siya karong buntaga sa programa, si Nicole Kimball. Good morning, Ma'am Nicole.
Good morning. Hello sa lahat.
Thank you so much, Ma'am Nicole, for joining us this morning. Can you share to us, Ma'am, your experience nung nagpa-vaccine ka for COVID-19?
Yeah, of course, of course. So, my first dose was on December 27. So when I got to the vaccination location, the nurse educated me with the expected side effects, like pain, swelling, redness, soreness on the injection arms. So she also mentioned my fatigue, headache, muscle pain, joint pain, fever, chills, nausea, feeling unwell. And these side effects may last to 24 to 48 hours. I was also advised to wait at least 15 to 30 minutes after the vaccine is given. So this is the story. When I got home, doon ko naramdaman na ang sakit ng arm ko. It's painful, it was heavy, at saka numb. Also, sumakit din yung ulo ko. Fatigue was present as well. Natulog ako all afternoon. Naramdaman ko yung tiredness, which is expected. And then on day 4, I am completely recovered. So I received Pfizer-BioNTech COVID-19 vaccine. It is administered as a 2-dose series, 3 weeks apart into the muscle. Administration of second dose has a 4-day grace period. Days 17 to 21 is considered valid. So my second dose was done on January 14. On that day, I only experienced sore arm lang. Wala yung heaviness, wala yung numbness. And then on day 2, yung deltoid muscle, masakit pa rin. And then my fatigue na. The fatigue was present. I slept 2 p.m. and then nagising lang ako para kumain. And then natulog ako ulit. And then woke up the next morning feeling well and rested. Day 3. Same experience with my first dose. My konting pain sa injection site, pero okay na yung pakiramdam ko. And then finally, day 4, I am completely recovered. No concerns, no complaints.
You were quoted as saying, Ma'am Nicole, na you'd rather have the side effects than get COVID, kaya nagpa-vaccine ka.
I rather experience the side effects of the vaccine rather than the complications of the COVID. I also base my decision to get vaccinated because I believe there is hope. Hope to end this crisis. Hope to be together and hug my loved ones again. Hope for life. So these are my reasons why I did the vaccine.
Pero before getting the vaccine itself, Ma'am Nicole, did you have any fears or mga doubts po?
Of course, madami akong doubts. So I work in healthcare. So the doubts is, yung safety if it was compromised during the process of making the vaccine, kung effective ba siya, or if the scientific integrity was compromised. Fear of the side effects, if it will cause more harm or complications. Fear of being a carrier at makahawa ng iba. At higit sa lahat, my biggest fear is the well-being of my daughter.
But how did you overcome those fears, Ma'am?
So overcome. At first, I follow the CDC recommendations such as wearing masks, frequent hand washing, social distance, and lumalabas lang kami to buy groceries. Second, I educate myself and did my research regarding COVID-19 and the vaccine. And third, and the most effective way for me to overcome my fear is to pray. So I told myself, when there is an opportunity for me to be protected, I will absolutely take it.
Ma'am, anong masasabi mo, of course, yung mga tao ngayon, lalo na dito sa Pilipinas, parang hindi pa talaga kumbinsido sa vaccine. Nagdadalawang isip pa, Ma'am, kung magpapabakuna ba. How can you convince Filipinos, especially itong mga nandito po sa Cebu, Central Visayas?
Okay. So, vaccination is one of the potential defenses we have against COVID-19 and to beat this pandemic, along with wearing masks, washing our hands, and observing the highest health standards. We are entitled to our own decision, and probably there are understandable reasons why some people are hesitant to get vaccinated. So, having a vaccine is a choice, and we must respect each other's decision. To make the right choice, consult your doctors whether COVID-19 vaccine is right for you. Vaccine will work with your immune system so it will get ready to fight the virus if you are exposed. So the combination of getting vaccinated and following CDC's recommendation to protect yourself and others will offer the best protection from COVID. And I believe we need to believe in science and in medicine. Now, I don't think so that they're going to do something, to put in the market, like in vaccine, to harm people and to cause more problem. Diba? Kasi it's not only our country, but this is a global pandemic.
All right, to cap this off, Ma'am Nicole, mensahe niyo po sa ating mga manonood, mga viewers natin, Ma'am, your message.
Okay. So this pandemic has broken families, crippled economies, destroyed jobs, derailed plans, and stolen lives. To my fellow kababayans, please stay safe, stay healthy. Never stop praying, never lose hope. We need this generation to work together and win against the pandemic. I have faith, and I believe we will all get through this together.
Wow, very well said. Thank you so much, Ma'am. We had interesting discussion this morning. Thank you at ingat kayo dyan, Ma'am Nicole Kimbo.
Thank you, Nika.
Thank you.